Welcome everyone to our special segment on eye health. Today we have with us a special guest who is an expert in ophthalmology, Dr. Biswajit Mondal, MBBS, DO and DMB, and who specialize in the field of micro and phaco surgery. So thank you, sir, for being with us here today. We will be discussing about some of the most common yet significant eye conditions like cataract and dry eyes. So to begin with, sir, can you please give us a brief about what exactly is cataract and how does it affect one's vision?
Cataract mainly a most common cause of blindness worldwide and visual impairment. Cataract is a normal aging condition. It grows according to age. There are some other causes of the development of cataract, most commonly seen in women and the Asian countries, and otherwise some medical conditions, common medical conditions, especially diabetes, hypertension, and our lifestyle also depends. Commonly the smoking is very common cause of cataract development. Otherwise alcohol intake, and another important cause is ultraviolet radiation. It develops cataract, and cataract causes basically the loss of vision, from mild vision loss, then the complete loss of vision.
Okay, sir. So is cataract just one type of disease, or are there different types of cataracts?
Cataract, grossly one disease is cataract, but there are various types of cataract which we know, which is required for our medical student purpose and surgery purpose. We need to know the types of cataract and their how they develop, but in general population they don't need to differentiate according to the types of cataract. Mainly cataract, when develop cataract, they usually they develop low vision from the normal vision and the fogging glass appearance of their vision, ground glass appearance. They develop when they develop cataract, they found that their eyes, one curtain or they are in front of their eyes, there is some frosted glass in between. They see that any person. Okay.
So, sir, what do you think is the right time for a patient to be seeking medical attention? Like, are there any early signs and symptoms?
The most common sign of cataract is low vision, and this is the most important and most common cause. Other causes are increased halos, increased glare. For drivers, most common symptoms of driver is glare. When they are driving at night, they develop glare, and other causes, other medical condition like glaucoma, diabetes, other rheumatic arthritis disease. That in that case, cataract always they need to surgery cataract as early as possible.
So, at what stage is surgery necessary?
Staging of cataract is there are 5 stages, 5 types and 5 stages of cataract. Grossly immature cataract and mature cataract. Immature cataract, nowadays the modern surgeries have come, so we prefer the immature cataract for surgeries. Mature cataract have some problem during surgery or post-operative care, so it is advisable to get surgeries before mature.
Yes,
okay, immature cataract is the ideal time for surgery.
So, can you brief us more about the different types of surgical options available?
There are many types of surgeries. Most commonly, one surgery is done nowadays, the microsurgeries. Manual MSICS, manual small incision cataract surgeries. This is very uneventful, and post-operative patient compliance is better. And now came phaco surgery, phaco emulsification. This is done with a phaco machine. There are some mechanics in there, and all surgeries depends on the lens, intraocular lens, which we surgeon are introduced after cataract surgery. Okay, so most important thing is intraocular lens, which we used after surgeries.
Yes. So, like you said, IOL or intraocular lens gets implanted during surgery. So, but these days there are a lot of options available. So,
Yes.
how can a patient choose the best option for himself?
This is a very important question. The intraocular lens, there are many various types of intraocular lens. Commonly rigid lens, common differentiation rigid lens and the foldable lens. Rigid lens is low cost. It is specially required for the underprivileged patient. And foldable lens, there are many types of foldable lens. Commonly monoocular lens, where only they need for near correction they need glasses after surgeries in monoocular intraocular lens. And now in modern days there are multifocal lens, EDOF lens, extended depth of focus lens. They are the specialized lens required for specialized patients. Okay, just for example, one patient needs only just reading or computer work. No, don't need any distance vision. They need the EDOF lens. Otherwise, a trifocal lens. But overall, monofocal lens is better. Monofocal intraocular lens. Most commonly, most commonly uses lens are acrylic lens or silicon lens. Okay, common companies are the Alcon, Apasami. They the main manufacturer of the lenses. Okay. Premium lenses.
Yes, sir.
And premium lenses depend on the cost. They increases the surgery cost. So one patient choose lens according their economic condition, according their medical conditions, according their personal choices also.
So, sir, can you share some of the precautions that needs to be taken post surgery, so that to ensure faster and better healing?
For cataract surgery, patient needs to go to an ophthalmologist at first for pre-operative checkup. This is very necessary for post-operative better outcome. If there is any medical condition like diabetes, it is the devastating condition for a cataract surgery or for his life. Okay. Otherwise, rheumatoid arthritis, any autoimmune diseases, others hypertension. This is the condition which need treatment before cataract surgery. There are two types of cataract. There is phacomorphic glaucoma and phacolytic glaucoma. It develops when cataract matures. It is due to ignorance of the patient. It is very life-threatening condition and vision-threatening condition. So patient need to go any ophthalmologist or any eye center before cataract surgeries. And during cataract surgeries, the work mainly for surgeon. After cataract surgery, post-operative follow-up and for cleanliness, hygiene. This is most important thing for patient. Medicine, role of medicine, not so much role of medicine after cataract surgery. Mainly the hygiene of the patient, and hygiene of the patient is very important for better outcome of cataract surgery.
So before we move on to other topic, would you like to give some health tips and advice to the viewers regarding cataract, like any lifestyle changes that they can make in order to slow down?
Cataract, basically we can't stop development of cataract. As we grow, cataract will develop for every person. Yes. Okay, but if we maintain some lifestyles, just use black goggles or sunglasses during bright light, daylight. If we eat some antioxidant, zeaxanthin, spinach, carrots, green leafy vegetables, seasonal fruits, it will just minimize the growth of cataract, but not stop cataract growing. Or otherwise, every year eye checkup is very necessary. Okay, this is the main. And after before, if surgeon told them for cataract surgery, then they should follow. And they should do the surgeries. This is very important nowadays. Cataract surgery. Yes. No medical treatment is available for cataract treatment. Only the surgery will cure the cataract.
So moving on, I would like to ask you a few questions about another very common eye condition, which is dry eyes. So can you tell us something about dry eyes and why is it so prevalent these days?
Dry eye is also a multifactorial disease. Basically, dry eye means dryness of the eye. Eye produces tear, and tear is very necessary to for our moisturizing of our eyes. So tear production, tear has three steps, three types of tear production, and there is the evaporation of tear. Okay, these are the most common causes of dry eyes. These two, and dry eyes causes some irritation, basically irritation and burning sensation of the eyes, grittiness, some mucus thickness of mucus, some discharge from mucus discharge from our eyes, and it is associated with other disease also. So dry eye mostly produces the burning sensation, foreign body sensation of our eyes, and it is very common. So no single point for this, it is multifactorial. There are many causes of dry eyes.
So from what I gather, screen time is also another
Yes.
major factor for dry eyes. Are
Screen
there
time,
any
computer work,
yes sir.
mobile use.
Yes sir. So are there any other major factors which contribute to this condition?
Major factor, basically women develop dry eyes mostly, and the dry weather, working condition, environment, and smoking. Also important cause is smoking for dry eye. Okay, alcohol intake, and this is the most common causes. And it also develops some medical condition also, Sjogren's syndrome, autoimmune diseases, diabetes also causes of thyroid disease, or uses some medications, antidepressant, beta blockers. This causes development of dry eyes.
So since this is a very common eye condition, a lot of people tend to treat it as a minor issue. So sir, can you please stress on why it's important to get it checked and treated on time?
Dry eye, at first dry eye not causing any big harm to the eyes, but it is very irritating. Okay, when you are doing something, your eyes get itching, foreign body sensation, burning sensation, so it need to treat. So there are various types of dry eyes and stages of dry eyes. At first we prefer to use the lubricant, carboxymethyl cellulose, this type of lubricants which is very near to our tear. This will help in first type 1 category of dry eyes, it will help. After that we can produce our more tears of our eyes. During when we cry, more tear, our eye produce more tears. So there are some medications which produce more tear. This is to type 2 dry eyes treatment. And type 3 we can there is some mucus plugs which we put at our inner canthus, which is found in our eyes. Okay, it will help the decrease evaporation of the eyes. So these are the basic treatment is tear supplement. There are various types of tear supplements, most commonly carboxymethyl cellulose. After that we can use polyvinyl alcohol, cyclosporin. These are the common medicines.
So
And patient needs to use this for lifelong. There is no cure of dry eyes. We can treat, we can hasten this progression, but we can't cure this.
so would you care to give some like some steps, simple steps, and people can follow at home in order to prevent this condition?
In modern days, we mostly use computers and tablets or mobile. We should use, but during our work in computer or in mobile, we forgot to blink. Okay, so frequent blinking is very needed for tear to spread over our eyes, and we should use any anti-reflection coating glasses. This is the common, and take plenty of waters, and we avoid the dirty weather, dusty weather, and humidification is very needed to avoid dry eyes, and avoid the common changes lifestyle, just to stop smoking, alcohol intake, this type of, and normal just take green leafy vegetables, fruits. This will help, but not so much help. If we develop dry eyes, then it will help very little. This is the just you check your eyes regularly to a doctor, an ophthalmologist basically. It is needed, and use medication according to their doctor's advice.
So, in order to treat this, the eye drops that you mentioned are enough to cure them, or do we need, in some cases, do we need to go for medical procedures?
Medical procedures have very little role. Basically, treatment of dry eye is tear supplements. Medical surgeries or other treatment is necessary when dry eye is associated with other diseases. That just our first topic, cataract. After cataract surgery, dry eye also developed. So we need to use the medications and a mucus plug. No, there is no surgeries for dry eye. Okay. Mucus plug is one type of instrument which we put our inner canthus to drain, stop the drainage of our tear substitutes. No, there are no medical surgeries, only tear supplement, and avoid some allergens, just changes lifestyle. This is there is no surgeries for dry eye.
Okay. So, if there is one important advice that you would like to give to the viewers regarding dry eyes, can you please share some insight?
One important advice, just minimize your computer, mobile use, computer use, TV. This is the main cause, and avoid very sunny weather. If you go use goggles, and take normal green leafy vegetables, and when you need, please go to the doctor, nearest doctor, and follow their advices. Okay. Because dry eye is very irritating, and for dry eye we develop the allergic eye disease when itching is most common, and for dry eye in future we develop the myopia is one condition which develop for severe itching of our eyes. Okay. So dry eye is the first disease who can develop many diseases in later of our life. Okay. So just follow the advice of the doctors, and use need to go to the doctor yearly for better outcome.
So, any important message that you would like to give out to the viewers regarding eye health?
Eye health, I want to tell them one thing, that don't panic. This is a common disease. After if you regularly visit the doctor or health assistant, then it will not harm your future. Okay. So blindness or blindness due to cataract or visual impairment due to cataract is mainly ignorance of the patient. So when you need to any advice, please go to the nearest eye hospital, and nothing but don't panic. This is a common symptom, and there are many surgeries here, many variable surgeries, treatment modalities available. Okay. So cataract surgery is common surgery, so don't need to panic. This is a common disease.
Thank you, sir, for your valuable insights.
Welcome.
Tao anchini anchina yatani kita Dr. Mandalani yatani kita anching regular ong check-up karong gen chim ong ode mamang jajeng anirang dong jawa jamano future nagba prevent kaswa ke daily checkups ka naman ang ode gumaknan makang china nam gopong china ne plakon mulata telbia